ও
শেপ একই দিকে দিয়েছে তো?
হ্যাঁ
টেবিলের উপরে রাখ, আমি পরে দিচ্ছি। one more blue sketch pen. Thank you. You see, at the first drawing, I have drawn the sternum with the clavicle and the humerus. Alright, the sternum with the clavicle and humerus at the acromial end of the spinous process of scapula, right? Got my point? And you see, there are 7 ribs I have drawn. The 7th one is at the ziphisternal junction. The 7th rib is at the ziphisternal junction. This is the first rib. This one is the first rib. This one is the second rib. Third, fourth, fifth, sixth, and this one is the 7th. Right? And these are the chondrosternal junction. That is, this part is cartilaginous. The dotted part is the cartilaginous part. Got my point? Alright. Now this is the acromial end of the clavicle. This is the sternal end of the clavicle forming the sternoclavicular joint. This is the humerus and two dotted lines are showing the bicipital groove. These dotted lines are in the first part is called the intertubercular sulcus. That is between the greater and lesser tubercle. So this is the intertubercular sulcus through which passes the long head of the tendon of the long head of biceps. Through this groove is passing the tendon of long head of biceps. Right? These two muscles. This is the Coracobrachialis. Write down. This is Coracobrachialis, and this one is the short head of biceps. Both are coming from the tip of the coracoid process. Both are coming from the tip of the coracoid process. So Coracobrachialis and short head of biceps are coming from the tip of coracoid process as a conjoint tendon. There is a conjoint origin from the tip of the coracoid process. Where is the coracoid process? You see, it is a point that is asked in the surface marking. This point is asked in the surface marking. Coracoid process is at the junction of medial 3/4 and lateral 1/4 and 2.5 centimeter below it. Alright. If you touch this area at the medial border of the shoulder, you will find a bony point. Alright, that is the coracoid process. From the tip of the coracoid process, there is a common tendinous origin of coracobrachialis and the short head of bicep. It is also asked which is lateral and which is medial. Coracobrachialis is medial and short head of biceps is lateral. Remember, coracobrachialis is medial and short head of bicep is lateral. This is also asked. Alright. Now, as you see that there are, I have drawn 6 costal cartilage in relation to the sternum and the 7th is at the xiphisternal. Right. Now, in the pectoral region, what we do, we give a vertical incision from the sternal notch. Vertical incision from the sternal notch, a little lateral to the midline, up to the 4th space, up to the 4th intercostal space. Alright. And then another incision along the upper border of the clavicle, upper surface, alright, upper surface of the clavicle up to the tip of the acromial process. What's my point? There is a midline incision close to the midline incision along the anterior aspect of the sternum up to the 4th intercostal space. Then a transverse incision from the beginning of the first incision up to the along the upper surface of the clavicle up to the tip of the coracoid. Then this triangular flap of skin is retracted downwards and laterally. It is retracted downwards and laterally, right? Then we will be able to see, number one, number one, the clavicular head of pectoralis major. The clavicular head of pectoralis major from the middle half of the anterior surface of clavicle, right? Then we will be able to see the sternal head of the pectoralis major. So here from comes the clavicular head of pectoralis major, right? Going to the lateral lip, not in the medial lip, alright, lateral lip of the bicipital groove. What my point? Then comes the manubrial head. This is the manubrial head. This part is the manubrial head. This is also coming to this end. And next part from the parasternal region up to the 5th costal cartilage. First, second, this is first, this is second, this is third, this is fourth, and this is 5th. Right? Up to these fibers, this comes at this level. Alright, joins with the and the part of the pectoralis major that comes from the 6th costal cartilage. That comes from the 6th costal cartilage, this one, alright, and the rest of the sternocostal fibers. This forms the posterior lamina. This forms the posterior lamina. This part forms the anterior lamina, where there is superficial fiber, that is the clavicular fibers, intermediate fibers, that is the manubrial fibers, and the sternal fiber, that is the deep fibers. What my point? This forms the anterior lamina of pectoralis major. So anterior lamina of pectoralis major forming the anterior wall of the medial wall of anterior wall of the axilla, which is formed by the pectoralis major. It has 3 types of fiber. That is the superficial fibers coming from the clavicular head, the intermediate fibers coming from the manubrial head, and the deep fibers coming from the sternal head. And the fibers from the 6th costal cartilage as well as from the aponeurosis of external oblique muscle. Fibers of the 6th costal cartilage, sternocostal fibers coming from the lower part of the sternum after the 5th costal cartilage, from the 6th costal cartilage forming the posterior lamina of the pectoralis major muscle. Alright, and these are inserted, these lower fibers of the posterior lamina, this crosses the upper lamina and is inserted above the anterior lamina. This lamina goes above This lamina goes above. So the lower border of the pectoralis major is twisted. Lower border of the pectoralis major is twisted and goes beyond the insertion of the anterior lamina, higher than the insertion site of the anterior lamina of the pectoralis major. Got my point? So at the lower part, this is continuous, like an U-shaped manner. At the lower part, the anterior lamina and the posterior lamina are continuous as an U-shaped manner. So you have seen the pectoralis major muscle. All right. Now, here lies the deltoid. Here lies the deltoid. Deltoid will come up to the, there will be deltoid tuberosity, there will be anterior fibers, that is the acromial fibers, posterior fibers coming from the spine of the scapula, right? These fibers are coming to up to the deltoid tuberosity. So this is the deltopectoral groove or infraclavicular fossa. This is the deltopectoral groove. This is the deltoid fibers. These are the deltoid fibers. These are converging to deltoid tuberosity. So there is a gap. That is called the deltopectoral groove. This is called the deltopectoral groove. So this is pectoralis major, the sternal head, the clavicular head, the manubrial head and the sternal head, and this is the lower fibers coming from the sick costal cartilage and from the aponeurosis of external oblique forming the posterior lamina, which is twisted and inserted beyond the level of the, above the level of the insertion site of the anterior lamina. Got my point? Now this is the deltopectoral groove where we can see the cephalic vein. Here we can see the cephalic vein. In the deltopectoral groove, we see the cephalic vein piercing the clavipectoral fascia. Where is the clavipectoral fascia? This is at the level of just below the subclavius muscle. Just below the subclavius muscle. This is the site of the clavipectoral fascia. Up to the coracoid process, this region is the site of clavipectoral fascia. This one. Got my point? This is the site of the clavipectoral fascia. Here you will see number one, the cephalic vein first, then the lymphatic, then the lymph channel, then the acromiothoracic artery, and then the lateral pectoral nerve. Here from you will get the lateral pectoral nerve. So there are four structures piercing the clavipectoral fascia. What is clavipectoral fascia? It is the fascia that above that split to enclose the subclavius muscle. Above it split to enclose the subclavius muscle. This is subclavius muscle. Reunites at the lower border and is continued to the upper border of the pectoralis minor. So this is pectoralis major. Deep to it is the pectoralis minor. This muscle is the pectoralis minor. Got my point? This is the pectoralis minor. So this is the pectoralis major with the pectoral fascia. This is the pectoralis major with the pectoral fascia. Got my point? Pointy. And this is the pectoralis minor. And below it is continuous to the axillary fascia. Axillary fascia is a continuation of the pectoral fascia. Axillary fascia is the continuation of pectoral fascia, right? Forming the floor of the axilla. And this continuation of the clavipectoral fascia below the pectoralis minor, this forms the suspensory ligament of axilla. This forms the suspensory ligament of axilla. Got my point? This is axillary fascia forming the floor of the armpit. It is a continuation of the pectoral fascia. This is pectoralis major. This is pectoralis major. This is pectoral fascia, which is continuous at the axillary fascia. Pectoralis fascia. This is pectoralis minor. This is subclavius. This is the clavipectoral fascia. This is the lateral pectoral nerve. This is the medial pectoral nerve. You see the difference in the course of the lateral pectoral nerve and the medial pectoral nerve. Whereas the lateral pectoral nerve is piercing the clavipectoral fascia, but the medial pectoral nerve is piercing the enchithment of the pectoralis minor as well as the pectoralis minor muscle and going to supply the both muscles, pectoralis major and minor. Lateral pectoral nerve can also supply both the muscles, that is pectoralis minor and pectoralis major. Got my point? So this is subclavius, where the two layers of the clavipectoral fascia in this two layers reunited into one border, continued as the clavipectoral fascia. It encloses the pectoralis minor and continued below as the suspensory ligament of axilla being attached to the axillary fascia, which is derived from the pectoral fascia. Pectoral fascia is the deep fascia of the chest. Usually in chest and abdomen there should not be any deep fascia. For its contraction and relaxation, if there is a tightness by the deep fascia, there will be restricted movement. But this pectoral fascia is there to go to the upper limb and the axilla. This pectoral fascia, that is the deep fascia of the chest, is present here only to go to the axilla as well as to the upper limb. If there is any teacher. Okay, please. Now you see, this is the part where we can show all the muscles of the chest region, right? This is the manubrium sternum, this is the first rib, this is the spine of scapula, this is the upper part of the humerus near its head. Alright. Now this is the pectoralis major, this is pectoralis minor. As I have told, this is the medial is the Coracobrachialis, this is the short head of bicep, this is the long head of bicep coming along the bicipital groove, right, with its synovial sheath. This is the axillary artery, this is the axillary vein, and cords of brachial plexus are in relation according to the length. Cords of brachial plexus are according to the relation, in relation of the axillary artery according to their length. That is the lateral cord, this is the medial cord, and this is the posterior cord. And as I have told you that the subscapulary muscle lies close to the scapula, whereas the serratus anterior muscle, this muscle is serratus anterior, right? Gaining attachment to the vertebral border of scapula, deep to the subscapularis. Can you see? This muscle is curving along the lateral aspect of the chest muscle and gaining attachment to the vertebral border of the scapula, lying deep to the subscapula. Got my point? So, and this nerve is the long thoracic nerve supplying the serratus anterior, long thoracic nerve of bell, supplying the serratus anterior, that takes origin from the upper 8 ribs beyond the anterior angle of the hip. You should remember this digitation of the serratus anterior takes origin beyond this is the anterior angle, this is the posterior angle of anything, right? These fibers of serratus anterior are taking origin beyond the anterior angle of the rib, upper 8 rib. Got my point? And these 8 digitation are how they are inserting into the vertebral border. The first digitation in the upper part of the vertebral border up to the spine of the scapula. Next, below the spine of the scapula, there are second, third or sometimes fourth digitation, and from 4th to 8th in the rest of the vertebral. Got my point? First digitation is the upper part of the scapula. Let me show you. First digitation, this is the vertebral border, this is the axillary border, inferior angle, superior angle, lateral angle or the glenoid, right? So this muscle is coming like this. So first digitation here, second digitation at second and third, sometimes fourth is here, and in the rest of the border there are other 4 or 5 digitation. Got my point? And this is the tip of coracoid process, where is the attachment of the pectoralis minor, together with the conjoint tendon of the Coracobrachialis and the short head of biceps. Got this pectoralis minor is coming up to its upper border and is continued. You can see it is continued as the coracohumeral ligament as well as coracoacromial ligament. This is continuous with the coracohumeral ligament and coracoacromial ligament. The pectoralis minor gets attachment to the 3rd, 4th and 5th ribs beyond the costal cartilage. That is not attached to the costal cartilage. 3rd, 4th and 5th rib beyond the costal cartilage. That is in the bone of the rib, bony part of the rib. And the serratus anterior beyond the anterior angle of the rib. Got my point? Done. And you see the clavipectoral fossa, medially it is up to the sternum, laterally up to the coracoid process, right? Medially it is continuous with as the anterior intercostal membrane, and the lower border of the clavipectoral fossa coming from the coracoid process up to the first costochondral junction. This is thickened, which is called the costocoracoid ligament. This is called the costocoracoid ligament, as it is the continuation from the first rib to the coracoid process. So it is called costocoracoid ligament. It is the lower border of the clavipectoral fossa, right? Now below it is continuous as the suspensory ligament of the axilla, attaching to the axillary fossa that forms the pit of our armpit, that is the axilla. Got my point? And the medial pectoral nerve, you see the disposition of the medial pectoral nerve and lateral pectoral nerve. Lateral pectoral nerve is penetrating the clavipectoral fossa, and the medial pectoral nerve is piercing the ensheathment of the pectoralis minor as well as the muscle also. All right. So this supplies the medial pectoral nerve, always supplies the lateral pectoral and medial pectoral. Got my point? And the lateral pectoral supplies the pectoralis major and sometimes can also supply the pectoralis minor. And there is the artery just above the upper origin of the pectoralis minor. There is cephalic vein from lateral to medial. There is cephalic vein, the lymphatic trunk, the acromiothoracic vessels, that is both vein and artery, acromiothoracic artery. And then comes the lateral pectoral, This is the relation, all right. In the acromiothoracic artery, that is the pectoralis minor divides the axillary artery into the 3 parts, right? One above the pectoralis minor is the first part, where from the superior thoracic artery comes. The part above the pectoralis minor is the first part of the axillary artery, right? Which is coming from the outer border of the first rib and extending up to the lower border of teres major. So what is the extent of the axillary artery? From the outer border of first rib to the lower border of teres major. This is the axillary artery. This is divided into 3 parts by the pectoralis minor. Above it is the first part, deep to it is the second part, beyond it is the third part up to the lower border of pectoralis teres major. All right. First part gives the superior thoracic artery along the upper border of the pectoralis minor. Second part gives the acromiothoracic artery. From these 4 arteries come out, that is the deltoid, acromial, pectoral and clavicular. 4 branches. And then comes the lateral thoracic artery from the second part. From the third part, anterior and posterior circumflex humeral artery. This is the anterior and posterior circumflex humeral artery. This is the anterior circumflex humeral artery, the posterior circumflex humeral artery. Got my point? And it is the subscapular artery. These three arteries from the third part. So first part, one branch, superior thoracic artery. Second branch, two branch, lateral thoracic and acromiothoracic artery. Third part, anterior circumflex humeral artery, posterior circumflex humeral artery, and the circumflex scapular artery, where from the circumflex scapular artery originates. Got my point? And if you want to subdivide the lymph node according to the disposition of, let me conclude. If you want to subdivide the infraclavicular lymph node, inferolateral to the pectoralis minor is the grade 1 lymph node. Superomedial is the grade 3 and posterior to the pectoral minor is the grade 2. Inferolateral to the pectoralis minor is grade 1. Posterior to the pectoralis minor is grade 2 and superomedial to pectoralis minor is grade 3. Got my point? When we do axillary clearance, we have to keep it in mind. There is another very uncommon, rare variant of the muscles of the pectoral muscle, that is the rectus sternalis. This is a strap muscle in continuation with the sternocleidomastoid. This is the rectus sternalis, which is pre-sternal and parasternal, and is continued below with the superficial part of the rectus abdominis. This muscle is important because sometimes in USG and ECG, also in CT and MRI, this shadow and mammography, this shadow confuses us whether this is a separate mass from the breast, alright, or the clearance of the breast malignancy is not complete, or there can be ECG abnormality. This is the importance of the rectus sternalis, which is a strap muscle, or in continuous with the rectus abdominis in the abdomen. This is rectus sternalis, above it is the sternocleidomastoid muscle. Got my point? This is segmentally innervated, just like the rectus abdominis. And in case of breast reconstruction surgery, or surgery of reconstruction of the thorax or head neck region, this strap muscle is sometimes used. This is its importance. Got my point? Let me conclude here. Okay. Thank you all. I will draw a better picture when I will describe some parts of the axilla. Got my point? Okay. Thank you very much.